AIDS, multiple sclerosis, anorexia, cancer, and childhood epilepsy. These are killers that the American people are no stranger to, but they are killers with the horizon of hope. 42 years ago, in 1979, in State versus Diana at the Superior Court of Spokane County, the defendant was tried for possession of cannabis, yet he won his case when he proved that he was actually using the plant to help treat his glaucoma. A doctor confirmed that traditional routes of medicine weren't helping, and this was huge because it was one of the first times in a court that it was proven that medical marijuana was doing work that other traditional drugs could not. We need to legalize medical marijuana now, and that's what I'm here to tell you today about. There is a high need for new medical advancements and a more natural path as opiates are running rampant in our country. So today I'm going to detail those exact problems that are going on and why this is such a pressing issue. I'm going to tell you how other states and countries have already implemented some of these actions and how it's gone for them, and also tell you how you as a WWU student can help this problem as well. Like those sicknesses that I mentioned earlier, I bet a lot of you have been affected by at least one or know someone who has been affected. These illnesses are things that have been treated with traditional medicine and opiates for so long because the real answer, or at least one of the real answers out there, has been demonized by racism and the government. In 1936, Reefer Madness came out with its slogan, Roots in Hell, referring to what they called marijuana, which was a term made to seem cannabis more Mexican and derogatory. Now, this is totally wrong because very accredited institutions like the National Institute of Drug Abuse already has THC medications actually FDA approved, yet so many people still hold these values from Reefer Madness and just that stigma, even though there's Marinol out there and Sesmet. This was all according to the Marijuana Research Report for the National Institute of Drug Abuse, and those both are approved for chemotherapy, patients with nausea, which is super important, and also people suffering from AIDS and anorexia with wasting syndrome. It helps them gain more weight and become more healthy. There's also CBD and Epidiolex, which helps childhood epilepsy, specifically Dravet syndrome, which is a really drug-resistant form of childhood epilepsy, and CBD has been shown to make massive strides for them, which is hugely important considering it's a natural drug that you're giving these children. The World Health Organization also published a comprehensive appraisal of the health and psychology consequences of alcohol, cannabis, nicotine, and opiate use in 1995. In the section where they put opiates, which are again commonly used for a lot of these illnesses, versus cannabis, it is stated, and I quote, "There is no risk of overdose associated with cannabis. Use of illicit opioids carries a real risk of overdose. This is 26 years of knowing that cannabis is safer than the opioids that are prescribed in the millions every single year here in America. According to Addiction Center's website, the average of 20 to 30% of people who are prescribed opioids misuse them, and 66% of overdoses in the United States in 2016 came from opiate overdoses. These are things that people are being prescribed, not just things that you're finding on the street. These are being given to you by doctors, and they're not safe. To give a little bit of reference on what 20 to 30% of misused prescription opioids, that is 60 million people for 30%, or all of Washington, Oregon, California, Montana, Idaho, and Nevada. This is a problem. All of the West Coast, this is a problem. We wouldn't be the first country or state to legalize medical marijuana, though. In the United States, there are already quite a few states that have it legal. 15 out of the 36 states that have at least some sort of program in the United States for marijuana are legally recreational, and 36 of those states have at least some sort of system set in place. According to a 2019 Where Does Colorado's Marijuana Tax Money Go article from the Colorado Sun, one of the first states to legalize marijuana in the country, they went in depth on where exactly the revenue from their marijuana goes. And their governor, Jared Polis, interviewed by Jesse Paul, said, "The industry is helping us grow our economy by creating jobs, generating valuable revenue, and that is all going towards preventing youth consumption, protecting public health, and safely investing in public school construction. Public school construction, public health, and preventing youth consumption are some of the most important things that are so underfunded in America today. And to think that some of the $6 billion revenue that Colorado gets is going towards helping kids and helping public schools is definitely something that America needs. Not to mention, again, it's profiting from a medicine. If you're wondering how much is exactly profited in Colorado, 15% is taxed from the grower to the retail, and then 15% is also paid by the consumer when they go to the retailer. So that's a total of 30%. Since 2014, $6.5 billion has been made in revenue, and $2 billion of that has gone into urgent funding needs like public school and environmental health. That is crazy. That's so good for Colorado, and just a great example of it's already in our country and they're doing so much. But if we implemented this at a federal level, we would go so far. So even just looking at the United States, we can see that it's working. But if you want to look on the grand scale of a country, while it is small, we can look at the Netherlands. The City of Amsterdam's official website states that their soft drug policy is similar to alcohol and tobacco, and they preferred to use a softer, more educational, helpful approach. They've found that with more widespread access of soft drugs, people are actually less likely to do that. With only 16% of adults in in Amsterdam having smoked cannabis, according to a 2017 Marist poll, as opposed to over 50% of Americans in 2017. Just the access to it reduces the stigma, makes it more accessible for people who legitimately need it, and often it's found, all the time it's found, when things are taken away from people, when they say you're not allowed to do something, it makes you want to do it more. So the approach that the Netherlands has taken with just putting it right there, I think has worked absolutely wonderfully. They're trying to undercut the black market actually with their medical advancements. They realize that this is a drug that can help many different people, but many different people have different needs and what they want. So they're working really hard on researching different strains and working to get it cheaper than the coffee shops in the black market, because while the coffee shops are legal, they're not medically regulated, and their goal is to really make this a medicine and not a recreational drug. The 2020 European Medical Cannabis Network article said that they are one of the leading ones in the country for research, and they don't want the result of not enough variety in the medical world to force people to go to coffee shops and illegal places. So now that I've told you about how other countries and states have done it really, really well, and the problem at hand with opiates and how there is an amazing medicine that is right under our fingertips, I'm going to tell you how you as a student can make a difference. There's actually action available on campus. The Psychedelic Club is listed on the WWU Associated Students website, and while it is Corona season, they are hosting twice monthly meetings over Zoom, so you can go ahead and find them there and see how you can join and learn more. Their goal is an open discussion of how soft drugs and psychedelics can be used in psychology and healthcare, and that is just really cool to me. And actually doing this project inspired me to give them an email and find out about this club. So hopefully I'll see you there. There's also, if that's psychedelic drugs aren't necessarily your thing, Students for Sensible Drug Policy is also a good option if you're more interested in the legislative or policy side. And then also, if you're not looking to get involved through the school, there's also the Multidisciplinary Association for Psychedelic Studies, or MAPS. If you go to their website, you can learn a lot about their struggle to get psychedelics and marijuana as legal as the other drugs that they allow us to put in our bodies, so that they can research them and hopefully change the world. And there's active ways to participate in them through donation, participation, and education, almost the most important. So I hope that now you know a little bit more about the medical marijuana scene, and that you truly want to help propel this into reality and make medical marijuana the healing that America needs.